Are areas of your epidermis unusual? Are moles changing? Is your skin just looking different? Are these aberrations just life's wear and tear, or are they abnormal? Dermatologist Dr. David Crow is here with the Skinny on uncovering skin cancer. Dr. Crow is on the staff of the Metro Health System's Department of Dermatology, and he sees patients at the main campus and at Metro Health's Westlake Health Center. Thanks for joining us, Doctor.
Thank you for having me.
Oh, my pleasure. So we all know our skin changes as we get older. We just have to look in the mirror for that. But we can't run to the dermatologist every time something changes in our skin. We see a new mole or something come up. What should we be looking for so that we can be watching out for skin cancer?
So there are a few different types of skin cancer, and my answer kind of depends on which type you're referring to. The first type is the most common of all skin cancers. In fact, it's the most common form of cancer in humans overall. It's called basal cell carcinoma.
Okay.
And that usually presents as a very slowly growing bump on the skin, sometimes with a central sore or ulcer that just doesn't heal. It often bleeds frequently.
Okay.
Usually presents on the head and neck in people who have had long-term sun exposure and have a family history of skin cancer.
All right. Second type?
Second type is called squamous cell carcinoma, and it also presents on the head, neck, and upper arms, areas of heavy sun exposure. Usually presents as a slowly growing bump, but in squamous cell carcinoma there's more often a thick crust or scale on top, which often feels like sandpaper, and sometimes it can even form a small, what's called a cutaneous horn growing from the top.
All right, so we have one that's like an open sore, bleeding. The next one is crusted, and the third type is?
The third type is malignant melanoma, okay. And while it's the least common of the three, it's also the most deadly if allowed to go untreated. And it usually either arises from or looks similar to the common melanocytic nevus or mole. And there's a few different things you can use to tell the difference between a normal pigmented mole and a melanoma, and we refer to that checklist as the A, B, C, D, and E of melanoma.
Okay. Tell us about that.
Sure. If you have two or more of these factors, you want to think about getting these lesions treated.
Okay, so we put on the screen, A is for asymmetry. What is that?
That basically refers to the fact that one side of the lesion does not look like the other if you cut it in half.
Okay.
B refers to border, and it refers to an irregular or ill-defined border. C refers to multiple different colors within the same lesion, or very dark colors such as black or dark brown.
All right.
D refers to diameter, which refers to something having a diameter of greater than 6 millimeters, which is about the circumference of a pencil eraser. And the most important, which is E in evolution, usually a lesion that's changing over a period of months.
So if you see changes over months, that's a warning sign.
Right.
All right, so are there treatments, and are they the same for all three of these things?
Well, if you catch the lesions early enough, surgical removal of the lesions is usually mandatory, or local treatments.
For any of the three types?
Right.
Okay.
For basal cell carcinoma and squamous cell carcinoma, the lesions have to be quite large for treatment to change.
All right.
For melanoma, it depends on the thickness of the lesion microscopically before a decision about definitive therapy can be made. If the lesions are quite thick, treatment becomes complicated, and chemotherapy or radiation therapy can become involved.
All right, and we all know sun exposure really is dangerous. If we're now 60 or 70, does it matter anymore?
Well, it's true that sun exposure is cumulative, but it's never too late to be diligent about sun protection to reduce your risk of skin cancer in the future.
So even as we get older, be careful of the sun exposure. Put on the sunscreen.
Put on the sunscreen. Avoid sun exposure at peak hours of the day, such as 10 to 2.
Okay.
And wear protective clothing.
All right. Thank you, doctor. Very good advice. Appreciate it a lot.
You're welcome.
All right, don't overlook the signs of skin cancer. The proof could be right under your nose, or it even could be on your nose. My thanks to Dr. Crow for an abundance of unblemished information. Don't take this lightly. Give a call. See a doctor. We'll be back.
To schedule an appointment with a Metro Health dermatologist, call 216-778-DERM. That's 216-778-3376. And to learn more, visit www.metrohealth.org/dermatology. Next, get in line to go online for Social Security.